Glasgow's skyline has changed. 4 of the city's oldest hospitals have closed their doors. And Scotland's biggest and most talked about hospital has taken over. The Queen Elizabeth University Hospital is the largest acute hospital in the UK and home to many of Scotland's specialist services. The sprawling hospital campus is one of the largest in Western Europe and equal to the size of 39 football pitches. Since opening 2 years ago, the Royal Hospital for Children in Glasgow has treated 180,000 children. With 256 beds, it's the largest purpose-built children's hospital in Scotland. Laurie's being cared for in the Children's Neuroscience Ward, which shares staff with the Institute of Neurological Sciences, the largest centre of its kind in Scotland. It's just one area of medicine that's benefited from the design of the super hospital. Because the Children's Hospital and the Adult Hospital are interconnected, medical expertise can be shared. This has been shown to improve patient outcomes and survival rates. Neurosurgeon Roddy O'Kane works between both hospitals.
From my viewpoint, it's been brilliant to have the kids' hospital move over here. It means that I can be cross a corridor and essentially be in the children's hospital, and then cross back and I'm back in the adult hospital. And so you find that your ability to see patients that you've been dealing with on and off over a while, you can maintain that much better.
8-year-old Isla was admitted through Children's A&E yesterday. She has a genetic condition that causes hydrocephalus, where fluid accumulates in the brain, causing debilitating headaches.
Oh, it'll give you such a bad headache, you'll not be able to participate in activities of daily living. So she will get worse and worse as this goes on. It'll affect her vision, and obviously if you have very severe headaches, you're not able to learn, but ultimately it would lead to coma and then on to death.
The build-up of pressure can become catastrophic within hours, so Roddy needs to operate today.
If you come in and you're the main seat, okay? And Gran's gonna take that seat on the side, okay?
That's my brain.
That's your brain. Can you believe it? The next time somebody says to you, you don't have a brain, you can say, well, I've seen it. And I bet they won't have seen theirs, okay?
Dealing with children is different to dealing with adults. Yeah, there's no doubt about that. And dealing with very young children, it's about trying to get them to understand what they have, why they have it, why you're going to do things, why you might do things that mightn't be very pleasant in the short term, and try to get them on board. So it's more time consuming and a very different way of working.
So, you see this white bit here? That's fluid that everybody has in their brain. Their brain has a brain water, okay? And it's kind of made, and it's made all the time, and it gets drained all the time. So, what happens is sometimes there's a blockage because the brain water kind of travels from here the whole way down, block. Yeah, you know the pipes at home? If they get blocked, you have to get a plumber, okay? And that's blocked there, and that's made this one very big, okay? We can't leave you with that because that's what's giving you the really bad headaches, okay? And it'll affect your vision. But you know what? There's a wee layer there and I can pop a hole through it. So the water will have a new way of going around your brain and it'll get absorbed and your headache will get better. Does that sound like a good idea? So I'm kind of like a brain plumber, yeah? Except I'll come on time and I won't charge you.
Say high five.
Ah, high five for that. Go on. Hold on in a wee second. You can just get Isla back then. If you're operating on children, you're very nervous. I have my own children, and so Isla's the same age as one of my daughters. So you can't help but transpose that onto your thoughts. But you have to try and remain objective. You have to just try and remember what you're there to do your job, try to remove the emotion from it, and get on it.
Can you tell me how you feel about having the operation?
I'm not feeling good about the operation.
Why not?
Because it scares me.
Without the operation, Isla's brain will be under increasing pressure and she could go into a coma. But the surgery she needs is not without risk.
Every procedure I do will carry a risk to life, and I have to let you know that.
Yeah,
okay?
I know.
Okay,
Yeah.
and so pardon me for being
It's
explicit
no, it's
about
fine.
it. The big risk is there is a big artery that supplies the brainstem down here, just where we make the hole. Okay, and that's the big danger with it. Okay, so the risk is very small with it, but it's there, and it's obviously very, very serious. Okay, but if she were my daughter,
Yeah.
this is exactly what I would
Right.
do
I'm
with
leaving
complete
it in
conviction.
your hands.
Okay. Well, I'll look after her as if she was my daughter.
Right, that's
okay.
fine.
So we'll get her down there, and I'll come and talk to you afterwards.
Okay, how long does it take?
The procedure, it takes about an hour to set up the equipment and 20 minutes to do the
Oh,
procedure.
you're joking.
Yeah.
Within an hour, Isla will be taken for her life-saving surgery. Over in the Children's Hospital, one of their 9 theatres is gearing up for young Isla's surgery. It's just 1 hour after she saw neurosurgeon Roddy O'Kane.
Scans are up, equipment's ready. Lucky socks are on.
Her painful headaches should be relieved by removing the fluid building up in her brain.
So this medicine sometimes feels a little bit tingly as it goes up your arm.
Isla's condition is commonly treated by implanting a shunt, a thin plastic tube which drains fluid from the brain into the tummy. But Roddy is using a more cutting-edge approach, which should last Isla a lifetime.
The alternative strategy, and probably a bit more contemporary in terms of neurosurgery, is where we pass an endoscope into the fluid lakes of the brain and make a hole so that the fluid can bypass a different way.
Okay. Knifey again.
Opening a head and manipulating brain or manipulating blood vessels around brain, there's risks of infection. There's a risk of causing a stroke. You could go under a procedure and actually come out worse. And there's the risk to life.
Roddy has drilled through Isla's skull so that he can release the fluid putting pressure on her brain.
Okay, that's me. You see that brain water coming out? Here we go. I'd say that's pressure. The Trevi fountain. Okay, lovely. Top lights down, please.
The pressure has been released, but the most risky part is still to come. They need to make a hole in the base of Isla's brain to divert the fluid permanently. This delicate procedure requires 2 surgeons.
Okay, I'll follow you.
Roddy is operating the camera, while trainee surgeon Paul Fivey makes the hole which will allow the blocked fluid to flow freely.
Give us a wee push. Nice and gentle.
Sort of hypospadias type.
Okay, just gentle back, come back a bit. Okay. Okay, inflate. Okay, down. Okay, and back out. It's certainly wafting a hell of a lot more. Okay, top lights on, to seal.
It's taken just 20 minutes, but Roddy won't know if Isla is okay until she comes round.
The sigh of relief doesn't come at that stage when you finish the operation. It comes when the patient wakes up and they're not damaged.
Hi, time to wake up.
She moved stuff yet? She moved? Yeah.
You're okay there. Is your operation all over? You wiggle your toes?
In this stage of the journey, I'm just plain and glad to be here right now, having not damaged her, now just to see what happens. We'll see how she progresses over the next few days and probably get a scan of her within the next 5 days to see if we've got function and flow through the hole we've made and see how she progresses.
Isla is back in the children's neuroscience ward. She's survived the operation, but Roddy must wait to find out if her headaches have gone. It's 16 hours since Isla's surgery to remove fluid from her brain. Surgeon Roddy O'Kane wants to find out if her debilitating headaches have gone.
So Isla, overnight, no temperatures?
No, no problem at all. She's been fine.
Been fine, and no problems with vision or anything like that?
Nothing like that at all.
Okay. Hello.
Morning.
How are we?
I need to tell you a question.
You-
When I put my head up and down, it sounds like water.
It sounds like water. Do you hear a kind of squishing sound? Yeah, that's just because your brain is just getting used to having drained the water. So sometimes you'll feel a wee bit of swishy inside your head. It'll all settle down. Has the headache gone, sweetie?
Yeah.
Yeah? Okay. So, no, all very well from this point of view. Wind looks nice and dry. So, fingers crossed. Yeah. High five me. Good. Okay. Early days yet, but every hour you move from surgery, the more stable the situation gets. So we got to watch her closely over the next few days. We'll want to get a scan on her to check that this procedure we've done is working. But we're doing well.
This is my balloon that number.
How are you feeling?
Good.
From when it opened 2 years ago, Glasgow's super hospital has witnessed the transformation of lives every day through the thousands of patients that pass through its doors. Since her treatment, Isla's headaches have gone.
I'm feeling great.
She's a lot more lively and more chatty than she ever was. And she's passed the headache from her to me.